Hello, 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 everyone, dear all. This is Dr. Muralikrishnan from Los Angeles. How is everyone doing? As we celebrate the International Women's Month, it is a time to reflect on the incredible achievements of women throughout history and to recognize the many challenges that still lie ahead. Women have made remarkable strides in the flight and in the fight of for equality, but there is still much work to be done. Women continue to face discrimination, harassment, and violence simply because of their gender all over the world. And women continue to face lots and lots of hardships, all over the world, and it is very, very unfortunately not acceptable incidents. Women are underrepresented in positions of power, both in politics and in the workplaces, and even in many times at home as well. And women are often paid less than their male counterparts, despite doing the same kind of job at times. But despite these challenges, women around the world continue to inspire us with their strength, resilience, and determination. Women are leading and the charge for change, fighting for their rights and for a better future for themselves and for the generation of women who will come after them. This month, we celebrate the achievements of women who have broken barriers and shattered glass ceilings. We definitely honor all the women who have fought for the right to vote, the right to work, the right to an education, and the right to be heard, even. We celebrate the women who have made their mark in the fields as diverse as science, technology, business, and the arts, the politics. There is something so special about a woman who dominates in a man's world always. It takes a certain grace, strength, intelligence, and fearlessness, and the nerve to never take no for an answer. Women are leaders everywhere you look, from the CEO who runs a Fortune 500 company to the housewife who raises her children and heads her household. The universe is built with a lots and lots of strong women, and we will continue to break down walls and defy stereotype. But we also still have to acknowledge the work that still needs to be done. We recognize the importance to continue advocacy to ensure that women have equal opportunities, rights, and protections. We must stand with women who are fighting for their rights and for justice, and we must commit to doing our part to create a world where every woman is valued, respected, and empowered. So let us use this month as a call to action. What do you all think? I don't have um, comment box right now. I will be very soon. So once I see the comment box, and I will definitely see what you are all acknowledging about my saying about these things. So let us use this month for sure as a call to action. Let us work together to create a world where women are truly equal, or at times even better, where their voices are heard and their contributions are valued. Let us celebrate the progress we have made, and let us commit to making even more significant strides towards equality in the near future. I really, really love this day to celebrate Women's History Month with you all, and it is really incredible. What is Women's History Month, first of all? I mean, I asked few of my friends, and they didn't even know. They said, oh, everybody celebrates, so we celebrate. So, happy Women's History Month. Oh, is that what it is? So, I just wanted to give a little brief about it. It originally started as a Women History Week. Women's History Month began as a local celebration in Santa Rosa, California. That's my state where I live in. In the 1970s, American feminist groups extended the now mainstream International Women's Day to Women's History Week, an effort to amplify women's history in schools. In 1975, the United Nations moved to formally sponsor an annual celebration of International Women's Day on March 8th. The force behind the movement made itself irresistible, and so more and more groups began celebrating the full week, as well as lobbying for it to be nationally recognized. The 39th President of the United States, President Jimmy Carter, designated the first National Women's History Week, the week including March 8th in 1980. Women's history observations started from there. By 1986, 14 of the states, I don't want to just list all of them, 14 of the states in the United States recognized March as Women's History Month. And the next year, the US Congress established Women's History Month as an annual federally recognized observance. Thereafter, each US president since 1995 had issued a yearly proclamation honoring the role of American women in history. It is celebrated with the television specials, political speeches, classroom learning, many women initiatives over social media posts intended to honor those special women in everyone's life, and also like what we do here today, an authoritative leader of the society or community to bring high achieving women such as these four incredible women in Science Today in a live broadcast with me to discuss their hard earned achievements, to share it with our current and next generation citizens to show how they made it. In today's episode, we are meeting four of the amazing, beautiful, and successful, incredible women who are immensely contributing in the fields of science, medicine, and research through their innovations or their specialty work. First of all, I wanted to remember their names, and then I'm going to be introducing them to you all. Dr. Saraswati Sukumar, Professor of Oncology and Professor of Pathology at Johns Hopkins Medicine, Maryland, USA. Dr. Manjari Murali, Assistant Professor of Health Sciences at Chapman University, California, USA. Dr. Shyamala Vinod Kumar, a musicologist and voice therapist from Tamil Nadu, Chennai, India. And Dr. Manjusha Vinjamuri, an acupuncturist and Ayurvedic doctor and practitioner from La Mirada, California, USA. Without much ado, let's start our celebration of Women's History Month. First, I would like to welcome Dr. Manjusha Vinjamuri, who is an Ayurvedic practitioner, licensed acupuncturist, educator, a clinician over, I think, 28 years of experience. She received her MD in Ayurveda from the University of Kerala, India, Master's in Acupuncture and Chinese Medicine from Southern California, University of Health Sciences, Whittier, California, and a fellowship in Integrative Medicine from the Academy of Integrative Medicine, San Diego. And she also has a bachelor's degree in Sanskrit. That's amazing. She received her doctorate in Chinese medicine from the Pacific College of Health and Sciences, San Diego, California. She has also completed yoga teachers training program. She is the founder, director of AcuVeda, Integrative Health Center in Los Angeles, California, and a faculty for the Ayurveda practitioner course at Southern California University of Health Sciences, Whittier, California. She was a faculty for Chinese medicine at Wongu University, Las Vegas, Nevada, and American University of Complementary Medicine, Los Angeles. She has presented papers at multiple conferences and conducted workshops on various topics. She is an author of a book for Ayurveda students on Ayurvedic terminology. Her special interest and expertise are in women health, neuromuscular disorder, autoimmune disorders, and psychological disorders. She performs acupuncture, various oil therapies, herbal, facial, and whole body detox. I'm one of them, so I can proudly say it. And in her holistic health clinic. So let us put our hands together to welcome Dr. Manjusha Vinjamuri on the world stage today. Hello, Dr. Manjusha. Namaste. How are you doing?
Namaste. Thank you so much for your wonderful introduction, Dr. Rose. And thank you so much for giving me this opportunity to
Of course, with
present
pleasure. It's
here.
with a great pleasure.
Yeah, and I would like to congratulate you to organize this program and also showcasing the wonderful women in this different fields. I saw your last week's program also, wonderful women, high achievers, and even though they are housewives, I would respect them the same way because in Indian culture, we say that we uh, always see that women are a form of goddess, right? We
Right,
respect
right.
our
Dr.
moms
Manjusha, it's
and yeah,
wonderful to see you in
yeah.
person. And before we start, I wanted to invite all our guests on stage, and then we can start our panel.
Thank
So
you.
next, I would like to bring an amazing singer, musician, and musicologist, Dr. Shyamala Vinod Kumar. Dr. Shyamala Vinod Kumar is an accomplished musicologist and professional vocalist with wide experience in performing and teaching music for students in India, the Middle East, and several other countries. She is a proficient voxologist. That's a new term actually I learned. Probably it's there for whenever it was invented, but to me that was a very new word. And she is a proficient voxologist offering voice therapy and voice culture training to several top ranking vocalists for various vocal styles. Among the many accomplished vocalists who benefited from her expertise are Padma Bhushan Sudha Raghunathan, so we all know her, Nityasri Mahadevan, Krishnan, Ranjani Gayatri, Bharat Sundar, Kunnakudi Bala Muralikrishna, Kumari Amrita Murali. It's just to name a few in the Carnatic music industry. And she had trained lots and lots of musicians also in the movie industries, I heard. And some of them even spoke to me about it, and I'm really, proud of what she is doing because that's something very important for the singers. She has also been instrumental in developing the voices for many upcoming playback and film music singers, and she has been a guide and voice expert on reality shows and competitions on popular TV channels in Tamil Nadu. She is a visiting faculty at the University of Madras, a professor at the University of Silicon Andhra, San Francisco, and ex-faculty at the Music Academy Chennai, and she is a founder of Sri Rajashyamala School of Music in Chennai. Let us join together to welcome Dr. Shyamala Vinod Kumar on the world stage now. Hello, Shyamala. How are you, ma?
Namaste. Hello, Rose. I'm doing fine with God's grace. How are you?
I'm doing very good. It's wonderful to see you after almost 40 years.
Yes, yes, yes.
We were college mates. we were we studied together at sometimes, and it's beautiful to see you, Shyamala. Just give me a few minutes. I wanted to introduce all our guests,
Yes,
and then we
please.
will start our panel very soon.
Yes, please go ahead. Please go.
Thank you so much. All right. So next, let me take let me welcome Dr. Manjari Murali, who is an assistant professor of health sciences at Chapman University, California. She is also a certified mindfulness instructor. She is a I wanted to say that right, neurophysiology, I think. She is a neurophysiologist by training, having received her PhD from Brown University and a Bachelor's of Science degree from the Lock Haven University of Pennsylvania. She received her mindfulness teacher certification from the Koru Mindfulness Center at Duke University. Dr. Manjari Murali enjoys teaching mindfulness to adults aged 18 years and older. In her role as a professor, she teaches neuroscience, physiology, pharmacology, and anatomy. Her current research interests revolve around the benefits of meditation practice on brain health. I need that, at least now. And the relationship between chronic stress and Alzheimer's disease risk. Beyond teaching, she speaks at conferences and offers podcast interviews on the benefits of meditation on brain health and mental resilience. So please put your hands together to welcome Dr. Manjari Murali on stage, please. Hello, Dr. Manjari Murali. How are you? Beautiful to see you again. You are on mute, Ma.
Namaste, and thank you for inviting me, Dr. Rose Muralikrishnan. I'm looking forward to meeting and talking with everyone on your panel today. Thank you.
Wonderful. Thank you. Thank you. So I have one more beautiful guest. I'm going to be bringing her in, and we are ready to start our celebration. And finally, I would like to bring in our amazing, incredible woman in science, Dr. Saraswati Sukumar, professor of oncology and professor of pathology at Johns Hopkins Medicine, Maryland, USA. Dr. Saraswati Sukumar is a breast cancer researcher who has dedicated her life's work to understanding breast cancer at a molecular level based on key differences found between normal and cancer cells. She has developed novel ways of treating breast cancer and very sensitive molecular methods for the early detection of breast cancer. She is the Barbara Rubenstein Professor of Oncology and served as a co-director of the breast cancer program at Johns Hopkins University School of Medicine since its inception. She has published more than 200 papers on her work, which have been cited by other scientists 37,635 times, illustrating the high regard for her in the scientific community. She has won many awards, the most recent in her induction as the Fellow of the National Institute of Inventors for the large number of patents granted for her work. That is something new I just learned today about her. I knew her also almost like 35 years, and that's amazing to know. A friend of mine is, just not only what I thought, and she's a more bigger, better than what I thought, and it really made my heart melt. Her work has now expanded from breast to colon. Yes, early detection of colon and cervical cancer. Her attention to all my male viewers, if any there, and of course for sure my son and my husband are watching. Her next frontier is to develop the sensitive test for prostate cancer with an eye to serving the underdeveloped nations of the world. She designs these tests to be easily implemented in parts of the world that have no screening for cancer. That's really amazing, right? And this work has been recognized and funded by several large grants from the National Cancer Institute. That's really, really amazing. Okay, such a busy high achiever. And let's see what she does during her free fun time. Dr. Sarasa, of course, that's how I call her, as I have known her for more than 3 decades now, and she loves to sing. I can take a little credit for that, as she was one of my ex-students. I started music for her, and she is an avid ballroom dancer as well. And I had seen some of her dances recently, and I was amazed. Even I cannot do it. And she's also a long-time meditator. She gives numerous scientific and lay talks all over the world. Let's give a big round of applause and welcome Dr. Saraswati Sukumar on stage now. Hello, Dr. Sarasa. How are you doing?
Hello, doing very well. So pleased to be here, delighted.
It's beautiful to see you. Oh my God, a woman in red. That's my favorite color. Awesome. So I'm going to bring all our panelists on stage, and also I'm going to have my big old thing so that I will not disrupt you guys when you all talk, on the panel. So let me just bring everyone on stage. This is really beautiful to see you all in one screen. How amazing. So I just wanted to, give an opportunity for you yourself to introduce to the audience as just briefly. I know I told them about your achievements to them, and just a brief introduction of who you are, and so that we can start our panel with all our incredible questions that I got for all of you. And Dr. Sarasa?
I'm Saraswati Sukumar, and I have been in cancer research for more than 40 years now, more than any of you put together. Very, very pleased to be here. I'm currently working at the Johns Hopkins University's Sidney Kimmel Cancer Center, and I'm a breast cancer researcher primarily. And as Rose mentioned, I'm a professor of oncology and pathology, and I do research mainly in the laboratory and also teach students and also mentor them. Thank you.
Beautiful, very nice. How beautiful. I mean, such a high achiever, and wonderful to have you with us today. And let me have Dr. Manjari Murali.
Hello, everyone. I'm Manjari Murali. As Dr. Muralikrishnan mentioned, I'm a neurophysiologist by training. So I did my dissertation work on these mechanisms that are involved in how our brain learns and remembers. So the physiology of learning and memory. And I've done research work on learning and memory as it relates to addictive drugs. So addictive drugs can basically hijack some of these systems in our brain. And I've also looked at learning and memory from the perspective of Alzheimer's disease. Right now, and for the past few years, I've been working as an assistant professor of health sciences at Chapman University here in Southern California. I mainly teach a lot of courses every semester. I teach neuroscience, physiology, pathophysiology, pharmacology, and anatomy courses for both our undergraduate health science students as well as our graduate students who are training to be physician assistants. So I spend a lot of time teaching, and in my spare time, I engage and mentor undergraduate students in research. And my research focus has now shifted to, as Dr. Muralikrishnan mentioned, the health benefits of mindfulness meditation. And so what I'm interested in is looking at the connection between mindfulness meditation and Alzheimer's disease risk. So there's research that shows that chronic stress destroys neurons in a region of the brain called the hippocampus, which is involved in learning and memory, and that's a region that's affected in Alzheimer's. And we also know that mindfulness meditation practice reduces stress. So my hypothesis is that, okay, if someone practices mindfulness meditation, can that mitigate or reduce their risk of developing Alzheimer's disease later in life?
Wow. Amazing. Wow. Wonderful. Thank you so much for the great introduction about what you do and how you do, and it's really beautiful to hear. Next, I'm going to have Dr. Shyamla Vinod, and let her introduce herself to you, and she has so much to offer to us.
Hi, I'm Shyamla Vinod, and I'm a voice therapist, a musicologist. I'm a professor at Silicon Andhra University, San Francisco, here at Madras University, and I'm running my school, which is now becoming a research center, Sri Rajashamla School of Music. And primarily, I am giving therapy to vocalists, most of them at the top level. And I'm really fortunate that I'm able to work with some of these highly successful voices, vocalists. Primarily, I do that, and I'm also teaching music from the basic level to the PhD level. We have a lot of students in our school who are also pursuing voice training, because therapy is different from voice training. I'm a licensed therapist, and I have my son helping me in the field. And I also work sometime for Apollo Hospital ENT department and the Sundaram Medical Foundation, because this is a very niche field. It's not speech therapy. We predominantly concentrate on vocalists, but we also take care of people who lose their voices because they use them extensively, like teachers, pastors, orators, lawyers, and even very small children with stammering issue. And if they have an inclination towards music, we give them therapy at our center here. So I'm from Kerala. My roots are in Palakkad, but raised in Chennai. Uh, was abroad for several years. Back in Chennai, back at the pavilion, and this is what I do.
Yes, your services are needed for India more than abroad. We
We have
have a
a
lot
lot of
of Carnatic
students abroad.
singers, yes,
Also abroad, a lot of
of
students.
course, of
We
course.
do get singers from other styles also. I would like to make mention about Miss Mirabella, a Romanian from uh, Dr. Zakir Hussein's, symphony orchestra. Also that of Zubin Mehta. And she came all the way from Romania, stayed here with us, and did a course on voice training in Indian style of voice production.
Wow,
So we do have
beautiful.
people all over.
Beautiful. Very, very lovely to hear that. Thank you so much for the great introduction. And next, I have Dr. Manjusha Vinjamuri. And Dr. Manjusha, it's your, please
Yeah, so
introduce
I'm
yourself.
Dr. Manjusha Vinjamuri. I'm Ayurveda, I'm MD in Ayurveda, and then also licensed acupuncturist. And I practice in LA. And then also I'm a faculty in of Ayurvedic medicine in a University of Southern California University of Health Sciences, and also I uh, teach Ayurveda. I had taught acupuncture before, and also I practice in University Health Center as well as in my own office. Yeah, and then
Beautiful.
Yes, ma'am.
And Dr. Manjusha is my acupuncturist too. And most of the time when I have pain, I have to say, Dr. Manjusha, please take care of me. So it is beautiful to know her.
And
And
I'm her
now,
student. I am Dr. Rose
she was
student.
my,
I was once upon a time, but I would
yeah,
like
she
to
was
do
my
that
vocal
again.
student. It's very beautiful, Manjusha. Thank you so much. And so now we are going to be starting our panel. I have some nice, beautiful questions to ask every single one of you. And I know Dr. Shyamala Vinod has next appointment. I mean, she is a teacher, and I know how important that is, and that is Saturday morning in India. So what I will do is I will try my best to leave you before 8:30. But
Thank
you know,
you.
but I'm going to mix and match the questions with everyone. But I will definitely try to relieve you before 8:30. Shyamala, will that work for you?
Definitely,
Beautiful.
definitely.
Thank
Thank
you
you.
so much. I appreciate it. And the first question I have here is for Dr. Saraswati Sukuba. What led to the choice of molecular biology as the subject of study, and what motivates you to continue medical research with the same zeal year after year after year? And I know you've been doing this for the past 40 years, you mentioned, and you know could you explain to us, please?
So when I began my research, molecular biology was a very new field. Uh, People used to have departments of bacteriology, physiology, anatomy, etc., but there was no such thing as molecular biology. Uh, so gradually, as people began to understand the structure of DNA and RNA and how a cell is put together, etc., it became clear to them that there were whatever you see happening in a human being is because there are molecular events, chemical reactions taking place. Zip zap. Basically, I'm speaking, and there are like thousands of reactions that are going on that result in speech. So when I was so fascinated by this field because I was in love with biochemistry. I did a master's in biochemistry, and everything I learned there was magic. How the circulatory system works, how the digestive system works. Truly, when you look at the functions that are going on in a human being, you can only think that there is a divine person who has put this together because it's such a beautiful instrument, the whole body. And day after day, the functions go on and they go on with such precision because if anything goes wrong, you definitely have, like you said, a earache, a leg ache, or a headache, or whatever it is that's going on. So it's all a question of all these chemical reactions going on so beautifully. So ultimately, you come down to the fact that it's the molecules that are at work, right? And how do these molecules work together to allow a biology to happen? The biology of respiration, of thinking, of this, that. How does it all put together? That became a very, very fascinating, and nobody knew anything about it. Everything was at its inception. And this I'm talking about, I did my PhD in 1978. So
Oh
you can
wow.
imagine how many years ago that was,
I was almost a
right?
baby, not
Right.
even a teenager baby, little girl.
So basically, when I did my master's degree, I was hooked. I wanted to do a PhD that where I understood what was going on little by little in this field in relation to medical science. So I did my PhD actually at Madras Cancer Institute in Adyar. Yes. So
Wow.
yes, and that's where I graduated from. And Dr. Shanta and Dr. Krishnamurti are all very
Oh wow.
famous, well-known folks. And of course, we all work together in that institute.
Oh
And then after
amazing.
after graduating from there, I came to the National Cancer Institute because it was the world's best known institute to be doing this kind of research where they were looking at the molecular mechanisms of disease. So I started my life there, and there again, we made some fantastic discoveries about what are called oncogenes. So it was in our laboratory that oncogenes were discovered. This was my mentor at that time was a gentleman
Wow.
called Mariano Barbacid. And
Wow.
so we discovered that there were genes inside our genome that behave perfectly normally under normal circumstances. They are keeping everything together, like I said. But if something goes wrong in them, if there's a mutation or some DNA is not put together properly, etc., that is called mutations in DNA. And when that happens in key genes, boom, a cancer cell is born. And so over time, that cancer cell acquires 3, 4, 5 changes. And at the end of it, it knows how to divide and how to defy all the principles of living like a proper citizen in a country. It basically
Wow.
has gone, all right, nothing controls it. And that is why cancers are, even today, such dreaded prognosis or diagnosis. When somebody says you have cancer, there is a dread that comes into you. And that is because we have succeeded in great measure to control it and to keep it so that the patient lives for 20 years, 30 years, but ultimately it takes over and kills you. So, this is where trying to unravel what happens in that cancer cell, what are the things that go wrong, and how can you set it right. That has been the focus of my research all these years.
Beautiful, beautiful. Thank you so much. That's such a, you know, I mean, I can't even imagine of what you had said, but it's very beautiful. And I mean, even till today, the cancer is the scariest disease, but still working in that one too. I mean, so far there are a lot of researches, a lot of cures, a lot of. I mean, I don't know whether there is still cure there yet, but still, to be in there to work on it for 40 years and more, it's amazing, amazing. Hats off to you.
And that's why, even after so many years of research, I wake up every morning wanting to do this work. And I tell people we are blessed. We are really,
Wow.
really blessed that you get up in the morning and say, I love the work I do. So people ask me,
Wow.
when are you going to retire?
Exactly.
And I say,
Actually, I was going to be asking, are you going to retire
they
now?
will have to take me out from the
Oh, wow.
laboratory.
No, no, that's the kind of dedication you have for the work you do, and it's amazing to know and hear about it. Thank you so much for sharing that, Dr. Sarsa. And next question is for Dr. Shyamala. And I wanted to know, Shyamala, because this is such a curious, I'm being a curious little baby girl in asking that because this terminology for me is very new. What is voxology? And how is this applicable for only vocalists?
Voxology is actually a non-clinical therapy for the vocal cords, vocal system, and this is primarily for vocalists because speech therapy is not enough for vocalists. So the prerequisite for a voxologist is to be a PhD in any vocal style. So I'm concentrating on Indian vocal style, and I should say I'm really blessed and fortunate to have done this course. And this happened this way. That I was doing my PhD in music when I was in Oman, and the topic is comparative study of Arabic classical music and South Indian classical music. That's how.
Did you say Arabic classical?
Yes,
Oh,
Arabic
wow.
classical. Yes. So I was learning Arabic classical music from Dr. Mohammed Yaqub. He's no more, an Egyptian who was my guide from Silicon Andhra University. So, and then came to know that he is a voxologist. Vox is voice in German, and the science behind it. And he had patented the course. It is still patented. Patency is with his son now. So I was curious. Also, I had a need to correct my vocal production because having been in the Indian system of vocal production and just all over, one fine morning starting to learn Arabic classical music, I'm sure you understand because it is based on microtones and ours is semitones. The only style with microtones is Arabic classical system. So it was very difficult to learn, and I should say my vocal cords had a cultural shock. So, I got some certain symptoms that I'm losing the facility of my voice. So then I enrolled for the course with Dr. Mohammed. First corrected my vocal production techniques, and then I did the course, which is 4 years. Plus, I did one more year with Al Nada International ENT Hospital to practice, diagnosing by the ear with the Arab singers there. So thanks to Dr. Mohammed, and then I'm back in India for the last since 10 years now.
Oh, wow.
And now I used to travel a lot between the Gulf and India to cater to the Indian singers, but now I'm back here and still traveling a lot. I'm very happy because I am, as Dr. Sarasa said, it's not work anymore when you are in your, field of passion. So it's not work anymore. So each time I'm handling a voice, it's like I'm learning something because it's an unseen part of your body, and an endoscopy, a laryngoscopy, can only tell you what it looks like. But what happens to the vocal cords while in motion, especially singing, which is much, much more complex than talking, is cannot be seen. So I have to hear. We have to hear, assess, then rectify the method of voice production, rehabilitate, and then enhance the voice. So there's a lot of stages that we go through in voxology, and I'm really enjoying this. But when I need a clinical intervention, because we diagnose by the ear, we are trained to diagnose most of the symptoms or conditions, clinical conditions like a phonatory gap, nodules, certain similar conditions, polyps. Then we need a clinical picture. So that's when we get in touch with our clinical counterparts. So we have counterparts here in Apollo, Sundaram Medical, and one more geriatric hospital. We also have opportunities to understand the voice of patients, who are suffering from Parkinson's disease. They used to be singers, so we try to help them improve their, or at least help them manage that inability to talk or sing. Even to phonate with Parkinson's disease.
Wow.
That
How
keeps us busy.
amazing. How amazing. Somehow or other, all of you are all like connected with what work you do, what researches you do, and all of us actually, in fact, the music and, like the cancer, like all the work, it's very beautiful to hear. Thank you so much, Dr. Shyamla. And the next question I have is for Dr. Manjari Murali. Science, technology, engineering, and mathematics, STEM careers have traditionally been male dominated careers, right? Tell us about what motivated you, being a woman, to pursue a career in STEM, your successes and challenges, and your journey in getting to where you are now.
Yeah, well, I, for as long as I can remember, I've always wanted to go into neuroscience. Um, I was always fascinated by how the body works, and particularly the brain and the nervous system. And along the way, I've been really fortunate to have had several remarkable female role models, both in my own family as well as during my education, and now, colleagues of mine at Chapman University as well. Just to name a few, I would say female role models in my life have included my mom, my aunts, um, my high school biology teacher back in India, um, my PhD advisor, as well as the female members on my dissertation committee, professors at reputable universities, and as well as several female colleagues that I work with today. So they were all been my role model. In terms of my journey getting here, successes, challenges. So I actually moved to the United States when I was 18 years old to go to college here. So I was an international student studying for my bachelor's in science in biology. And I actually did my undergraduate education in microbiology and molecular biology, Dr. Sosa. And after I got my bachelor's, back then there was no such thing as a neuroscience major when I came in the late 90s. And so that's what I did. And then I took 3 gap years, during which time I actually worked as a research assistant in the field of epidemiology and public health, because I had that microbiology training and molecular cell biology training. So that's what I used. And while working as a research assistant, I took courses as a post-baccalaureate student in neuroscience and pharmacology, because I knew I wanted to go get a PhD in neuroscience. And I also did some research because I worked at a university. I was able to do some research with a neurotoxicologist who was studying the effects of lead poisoning on Alzheimer's disease. How does that, can that cause Alzheimer's? How does that affect the proteins that are disrupted in Alzheimer's? And then I was, I set my goals high, but not expecting to be able to get into an Ivy League. And lo and behold, I got accepted at Brown University. That was one of my successes, highlights of my, early, education and career. And then at Brown, I trained, of course, as a neurophysiologist and a neuropharmacologist. And I already mentioned that I did my research on this mechanism called synaptic plasticity, which is how our brain learns new information, new skills. This is how we recall memories, etc. And I looked particularly at the effects of nicotine on a circuit within the brain and how that affects learning in that circuit. So that was my journey. And then after grad school, I actually took a 6-year hiatus to raise a family and to support my husband's career. So we made the cross-country move from Rhode Island to Southern California. And so I left my network behind and I moved here. And after my daughter started school, I decided to go back to work. And of course, I had no professional network, and I'd been working part-time and in nonprofit, off and on, part-time, temporary, contractor type positions. But returning into academia proved challenging. And in Southern California, there's a huge population. There's the supply is always less than the demand. Sorry, the other way around. The demand is always, there's a lot of people looking for a few jobs. So the only way you can get into an academic position that's teaching intensive would be to start as an adjunct. And so that's what I did. I started as an adjunct lecturer, and I taught at local colleges and universities here for 3 years. And the average in Southern California is teaching as an adjunct is about 5 years. So I set a goal of 3 years for myself, and by the grace of God, a lot of hard work, and people recognizing that, I was able to get my current full-time position after 3 years of being an adjunct. I'm really grateful for everyone that has helped me, my mentors, my colleagues, my superiors, family, friends, everyone helped me get to this place. Awesome. So those are successes, challenges. Being a woman in STEM is not very easy, but we can do it. We are all capable and intelligent, and if you're passionate enough, we should do it. We should pursue it and not let anyone discourage us.
Awesome. Very nice, very inspiring. And I have, this is really beautiful to hear that. I mean, that's one thing for all girls and women, in your early 20s or mid-20s or early 30s. You have to do a lot of sacrifices for, to raise the family, to be there for the child. And, so part of you always, take a pause, from your running movements, and some drop it there and just settle there. Some pick it up and run, and some run while they do it, and it's really amazing. It's very inspiring. Thank you so much for sharing that. And my next question is for Dr. Manjusha. I know you practice acupuncture and Ayurveda, and these are very different systems than the conventional path. So, what made you learn these fields of medicine instead of the traditional, typical American English medicine?
Yeah, so actually, I had a dream from my childhood to become a doctor. When I was around 5 or 6 years old, I was visiting my family doctor and sitting in his lap and trying to imitate what he did, what he was doing. And then, like, I really was interested, stethoscope, this, that. I was like to handle everything. So he was like telling my parents she will definitely become a doctor later. He encouraged and inspired me that time, I think, and then it was my dream since then. And after high school, I applied for this typical conventional medicine medical school, but due to high competition, I I was put on the waiting list, and that's why I chose the Ayurveda school to get little bit closer to my dream. And later, after a few months, I was off of the waiting list and I got admission to medical school. But by that time, I was so engrossed and impressed by this Ayurvedic system, holistic system, and I was really like wanted to learn it. And I continued learning, and I denied that medical school admission. And I am not at all like I don't regret my decision at all. And after finishing my MD in Ayurveda, I also got amazing opportunities to like being a department head of Goa Ayurveda School and being a co-founder of Nagarjuna Ayurveda Center in Hyderabad. And all these experiences really solidified and that I wanted to do my this as my career. And then later I came here really to more with the dream of propagating Ayurveda in other world, other part of world. And then I saw here that there is already Chinese medicine was a more popular and well accepted medicine here, holistic medicine, and it was licensed practice too. So I also, and again I found out that these two medicines systems are very similar, and that's why I also chose to learn acupuncture here, and then I did master's and doctor's degree here in acupuncture medicine, Chinese medicine, and that way I'm practicing both the medicines together.
Yes, yes. I'm glad you decided so that you could treat me.
Yeah, thank you.
That's a very beautiful, inspiring story. Like, I mean, so I also wanted to become a doctor. It didn't happen. So I thought, okay, in whichever way, in whichever thing I do, I have to become. So I have to have the DR in front of my name. So I still did it through music. So it worked. So it's all like what you wanted to do, you keep doing. Force yourself to do in whichever way possible. It definitely happens. That's beautiful. And this next question is for, I'm more curious since she will be leaving soon. I wanted to get some ideas, of. So what exactly, the voxology is said, right? So what exactly is the procedure, and is there a defined time duration for this procedure?
No, we cannot have, the moment we use the word therapy, we cannot define the time of progress or recovery. It is different from one vocal system to another. And one thing we have to understand is the vocal system is so unique to each body. It is even more unique than the blood group, because you can match blood groups, you can transplant several organs of the body, but the vocal system, once damaged, cannot be replaced with another one. It's always an artificial system which is being implanted. So it is that unique. Even the voice, you can imitate somebody's voice, but we can still find out the difference in terms of the depth, the timbre, the stamina, the facility. Everything is going to be unique. It's so amazing. Like Dr. Sarasa said, it is all the more saying there is a power up there, you know, and it's so complex and amazing the function of the vocal system. So it all depends on how the vocal system of an individual human body is responding to the treatment. So the duration is, we can never fix the duration. But the procedure is first we assess the voice and preferably an in-person assessment, because we see how the person is using the jawline, the facial muscles, everything matters in the type of the sound of the voice. But sometimes we do have online assessments and then we give exercises to rectify the particular inability or discomfort the singer is facing. After which we rehabilitate because any improvement should not be by compromising an inherent strength of the voice because vocal cords work on the basis of ability and the demand we place, which is going to be highly individualized. So then we rehabilitate the voice, and then of course we work on augmenting the facility of the voice. So there is absolutely no surgery for nodules. I think I can use the word India because we correct the nodules. We help the singer to come back from nodules, redress without surgery, with our
Wow.
exercises. And so there's no more surgery for nodules.
So even if they have the nodules, they can sing. I mean, by rectifying it without.
Yes, yes,
Oh
yes.
wow.
So I'm mainly talking about singers. So they just disappear. The vocal
Oh,
nodules disappear. They regress totally, 100%.
beautiful.
And then we rehabilitate them and correct the voice production technique so that they don't recur.
And can this method transform the voice later on? Like, do they regain their voice?
Yeah, they do regain the voice and they get the entire facility 100% back.
Wow, 100%.
Yes.
Is this method of therapy applicable to all styles of vocal music, or is
Yes.
just okay?
All styles because vocal nodules is a clinical condition.
Wow, beautiful. That's wonderful to know. Thank you. And sometimes I lose my voice. I don't know whether I have a nodule or sometimes when you kind of feel like you're choking. I thought maybe I'm getting old, and stuff like that. So it could be, like maybe I overuse my voice, by teaching,
Yes, it's called
you
a
know.
vocal abuse, and
Yeah,
you don't have nodules.
I do lots and lots of vocal abuse. Now I have
You don't
three.
have, sorry, but you don't have nodules. Please remove the fear from your mind.
Okay.
We can tell you when, as I'm listening to you, I can tell you whether you have nodules. You don't, but you do have a
Thank you, Shamla.
phonation- phonatory gap. It's a least of the concerns, which can be corrected over a fortnight if you are very diligent.
Beautiful. Thank you so much. I'm going to talk after this session. I will talk to you soon. And I do a lot of vocal abuse. I mean, not only by teaching, because every student, whatever is their pitch, I teach in their pitch. If a male student is learning, I go to C. If a child is learning, I do teach in, A. And if older woman is learning, I do teach in F. And I do use all different kind of pitches, and naturally singing longer hours with the different kind of pitches, it uh, does act upon me.
No,
And
which by itself is not harmful.
right. And
So
on
that you're
top
not
of
prepared, yeah.
and on top of it, I have three German shepherds running behind them screaming.
That may be the reason.
So you can imagine. That's wonderful. Thank you so much for telling us about it. And the next question here is for Dr. Sarasai. Tell us a little bit about your recent work in African countries. I heard South Africa, Nigeria, and soon in Ethiopia and Zanzibar. So I would love to learn a little bit more about that, please.
Sure. So we have spent many, many years trying to find out differences between cancer cells and normal cells. This is what I told you before as well. And in doing that, there are many different changes that can take place in a cell that would cause it to become a cancer cell. So this can occur at the level of the DNA, which is what I was saying. There could be mutations, or there could be breaks, or there could be what we call translocations, where one small piece of DNA goes to another chromosome and attaches itself. And then as a result, that cell has now this abnormal stuff going on and becomes a cancer cell. Yes? But we discovered many years ago now, 20 years ago, that these cells can undergo what is called epigenetic changes also. So the DNA changes are called genetic, and they could come from your grandfather, father, etc. But they could also happen during your lifetime. So one is called inherited and one is called sporadic. But other than these, there is a form of change called epigenetic change. That means there's just chemical changes on the DNA which can be removed or put on. But we realized that these chemical changes can be like red flags to say, I'm a cancer cell, right? And these changes take place very early in cancer. So we thought, that's great. We can study how those molecules are put together, etc., forever. But that's not going to help the cancer patient immediately. What will help them is if we are able to tell them by looking at their blood or looking at a small piece of tissue from that lesion, whether it's a cancer or not a cancer. So now slowly our work took us to the area of early detection of cancer. So for breast cancer, we saw that a bunch of genes, about 12 genes, if you take a panel of them and you test them in the tumor cells themselves, or if you just take DNA that is floating. So these molecules are floating in the blood because the tumor is shedding that DNA and it's now in the circulation. So if you take just 1 milliliter of plasma or serum, you extract the DNA from it and you test for these markers. If they are present, almost invariably, that's a cancer patient. And if they are absent, they are normal. So many of you may know that many women have lumps in their breasts. And they come very worried saying, hey, there's a lump here, there's a lump here. Now, we in the United States or in the developed countries can go get a mammogram and say, despite the fact that it's so painful, they can at least tell you this lesion is benign or this lesion is cancer, because they'll follow it up and see what is happening. But almost 70% of the world, women don't have the chance to do that. There are no facilities. There is no mammogram. So usually the rich countries say, here is a mammographic machine. Please use it for mammography in your country. Well, they use it for 2 or 3 years, and then the machine breaks down. And so the repairs are so great that they're just thrown into the back room. In fact, when I visited China, there were these big machines in these back rooms, and I was asking, what's going on? He says, we can't repair them. So now what are you using? They say, we're using ultrasound or we use something else.
What?
So this is a problem in most of the world. And I realize this is also a problem in the remote parts of this country, as well as in many, many parts of India and in Africa and so on and so forth. So I thought what we have to do is not only have a detection method that can be applied to the rich countries, but it has to be applied equally well and cheaply to the poorer countries of this world. So as I said, the developed countries have mammograms, and therefore they don't need this test for breast. So who needs it? When you go to Africa, as I did once just to find out what is going on, the clinic has about 200 women in snaky lines, all with some lesion in their breast which they can feel. So these are palpable lesions in the breast.
Wow.
And maybe 50% of those women will have benign lesions, but 50% will have malignant lesions. But by the time the doctor takes a biopsy and gets a pathology result and so on and so forth, it is 6 months to 1 year before treatment begins for these women. So I said, this is a terrible, terrible situation. Can we develop a method that right there, when she comes to the clinic, they can take a fine needle put it into that lesion, take a little fluid, and can we detect cancer in those cells or not? And sure enough, our test was able to detect cancer in just that what fluid came out in that fine needle. Very sensitive test. So, can we use our very sophisticated laboratory test and go to Africa? No, we cannot do that. So, what we did is to collaborate with a company in California called Cepheid, and they make little cartridges just about that big, which the whole test can be done in 4 hours.
Wow.
So the woman comes in, you put a needle in, take it, put it into this cartridge, put it into a machine, and within 4 hours, she will know, is this benign or is this malignant?
Wow.
So
Beautiful.
what does that do? That prevents her from going up and down. Once she comes to visit, she's there, she's trapped, she knows, yes, this is a cancer, she must take care of it. Otherwise, if you tell her, come back for this test and come back, she won't come. She's got 4 children at home. She cannot be taking this trip every day. So that day itself, if you tell her, this is what is the problem, we are going to do a definitive test right now, and we will give you the treatment by the end of the day or by tomorrow. She will be there. And by just doing this, we might be able to save 70% of those women.
Wow. Wow.
So
Amazing.
we feel that this shortening the time to diagnosis is most important for those women, and therefore we might be able to help with such a test when it gets developed. So right now I have a large trial going on there where 720 women's fine needle aspirates will be sent to us, and we will examine them here and then find out whether the test is worth it or not. So that is for breast, right? And so
Wow.
similarly for colon, we've developed a test in the blood. In colon cancer can be easily detected in blood, even stage 1 colon cancer. But the people who come there come quite advanced. So we're trying to see
Yeah.
whether expensive methods can be put aside and these very cheap methods can be instituted for these many different cancers.
Wow. Amazing. Amazing. That's really amazing. Lovely. Very amazing. So thank you so much for sharing that with
Thank you.
us. And the next question I have is for Dr. Manjari. You teach neuroscience, physiology, and anatomy courses to undergraduate health science students as well as graduate physician assistant students, you said, right? And what is your teaching and mentoring philosophy? And what advice would you give to girls and women interested in pursuing STEM careers?
Yeah, so being in Southern California, my student population, our student population here is quite diverse. So in addition to Caucasian and Black students, we also have Asian and Hispanic students, and quite a few Indian students as well. And in our undergraduate health science major, the majority of students are actually females. Now, I have to tell you that this starts dwindling as they go into grad school and beyond. But at the level of the undergraduate education, we actually, in health sciences, we have more females than males. And one of my responsibilities is to be a student advisor, help them pick the right courses and the right sequence so that they can graduate on time and, get into a good graduate program. And so when my teaching philosophy in general is, I'm being a scientist and an educator. I really want my students to come out of their undergraduate or even graduate education with a strong foundation in biomedical physiological concepts. Because most of these students, the undergraduate students, are going to go into healthcare professions. They're going to become doctors, physician assistants, physical therapists, dentists, and so on. And then, of course, my physician assistant students are at the brink of that, starting that career. In the scientific discipline, as we all know, it's all about collaboration, being able to work as part of a community. We are, scientists. We each ask and solve a small piece of the question, And then a big part of that is being able to communicate that with the rest of the community so someone else can repeat what you did and then take it to the next level. So that everyone is not solving the same piece of the same puzzle, but rather building upon answers that have already been, resolved or discovered by other scientists. So a large part of what I do is I train my students to work together, team, in teams. Also, clinical skills. That's a big part of our training. So our health science program is ranked very highly because of the clinical skills that we provide. We teach in our physiology labs. We teach our students how to run and read EKGs. We're teaching them how to do echocardiography. Or at least the basics, that's more complicated. And then we teach them blood pressure measurements, deep tendon reflexes, things that they will need and learn in their graduate healthcare education. And we teach them how to take patient vital signs, patient assessment. These are things that a lot of undergraduate programs don't usually teach their students. So our students are really prepared going into grad school. And then in terms of how I mentor my students, with all my students, whether they're males or females, I share my struggles and successes. I tell them, Dr. Muralikrishnan, you mentioned glass ceilings. So I talk about glass ceilings. It's like, if you're really interested, if you're really passionate about this field, do that terminal degree, because otherwise you're going to hit that glass ceiling and you won't be able to get further promotions and salary raises after a certain point in your career. And then by then you might be in midlife, you might be, have a lot of family responsibilities. It might be difficult to go back to school and get that terminal degree. So plan your career now, with your value system in mind, with your goals for personal life, for family life, plan ahead. And pace yourself, be forgiving of yourself, but plan ahead and try to get your education done so that you can start on your career path. I also tell my students, have a support system. It's really important. Don't think that you can do it by yourself. Because I thought that I could, and I tried, and didn't go too well. I've come to realize that it is a support system is essential. So build that support system of people who care about you, who want you to succeed around you. And you be that support system for others. So when you get to a position of power, or a position where you can be an influencer, do it. Don't sit in the sidelines and watch someone being oppressed. Stand up for them and help them when you can, when you're in that position. Yeah. And remember that someone helped you get here. When you needed the help, someone provided you that help. So this is sort of what I tell my students. And I also, finally, I would say one important thing, being a mindfulness practitioner and all, and just having not done this for the longest time, I really am a proponent of work-life balance. So I tell my students, you're going into these highly stressful professions. Healthcare professions are highly stressful professions. So start developing and maintaining that work-life balance now. Figure out what your value system is. Find something that you're compassionate about, that you want to volunteer, and set aside time for yourself and be forgiving. Take care of your physical self and your mental health as well. So I really encourage my students to start early. I didn't, and I wish someone had told me to start early. So that's my mentoring philosophy.
Awesome. And my next question is for Dr. Shyamala. Let me ask you, you said that you have studied classical Arabic music. I would love to hear a sample of it if you can, just a little bit.
Yeah. أنا في انتظار خيالي أنا في انتظار خيالي ناري في دموع وهتي بصنيع وعلقي आना फिर इंतजार
Wow. Wow. That's amazing. And I know her as a classical Carnatic singer. We grew up together. We were like 80s children, right? And she's such a beautiful singer, and we all go to competitions and this and that. And this part of it, I'm completely unaware of about her. Actually, in fact, to tell you all the truth, that we spoke after 40 years. This is amazing, Shyamala. Thank you so much. I know that you stayed a little over than the time limit of yours. If I really wanted to, most of the question I covered with you, but I'm so thankful that you stayed with us for this long, and also you provided your voice for us. And I will definitely call you soon to get some advice for my voice also. Thank you again so much for joining
Thank
us.
you so much. And, my co panelists, I'm really, really inspired by you all, doctors, Sarasa, Manjusha, and Manjari. And thanks so much. I overstayed because it was so tempting to listen to them. Thank you so much, Dr. Rose, for inviting me here. I can't thank you enough for this great opportunity and hoping to meet you all in future. Namaste to all and thank you so much.
Thank you,
Thank
Thank you
Shamla.
for all the inspiring work you're doing as well.
thank
Thank you. And it's really amazing to have her with us. And I know, like, I don't want to put her under pressure. She said 8:30 she had some classes. Okay, so now the next question I have is for Dr. Manjusha. I'm curious, these two fields are different from one being Indian and one being Chinese. So how do you practice them together, and why do you choose to do that? And the Chinese, how do you practice them together? Um, like in the same time in the same clinic. So do you have clientele differently, Indians and Chinese, or you practice that on everyone who comes there? How does it work?
Okay, so these two systems seem very different, but they are both ancient system of holistic medicine. And then one is from China, one is from India, but they both are Eastern systems, and they have same philosophical foundation, and then they are the whole systems of medicine and complementary, um, like science. And both these systems have same diagnostic methods like pulse, tongue, and all. They are our tools, and they have many common herbs among them, like. And acupuncture is unique to Chinese medicine, and panchakarma or detoxification therapies are unique to Ayurveda, and they are really having amazing results in patient in multiple ways. Dr. Sarsa was telling about this early detection of cancer and moleculars and many antioxidants and molecules, which floating molecules she was mentioning to all these things. And I really was thinking that these type of detoxification methods are really a powerful tool for that, because they reduce the uh, toxic load in our multiple systems, and then they boost immune and boost the natural killer cells function, so which really helpful in such kind of pathogenesis, I believe. And there is much research studies are going on, but still not that enough. But definitely we should do more. And then how do I implement them? That is really actually very easy and natural for me. Like, as I mentioned, they both are having the similar philosophy. And then for example, like, if anybody comes to me for the uh, like as a patient for some fatigue or something for Ayurvedic system, then I will do then Ayurvedic therapies, but then I will also add some acupuncture therapy, because many studies show that it alleviates fatigue and also pain. So that I can add, but only if patient is open for this. And I may evaluate them and diagnose as an Ayurvedic, but as an supportive therapy, I will add acupuncture to it. Or same way, acupuncture patients, they are referrals from multiple insurance companies, and then when I treat them, sometimes I use oil therapies from Ayurveda, detox therapies, or some herbs of Ayurveda together, because those all philosophies being same, they are mutually supportive to each other. So these two systems I combine very well in my practice, and definitely patient's need and patient's preference drive my decisions whether
Awesome.
to take them or
Very,
go
very happy to know
together.
that.
Thank you.
And my next question is for Dr. Sarasa. I knew you as a fresh assistant professor at the famous Salk Institute in La Jolla, San Diego. La Jolla, it's near San Diego. And I had, followed your, you definitely had followed whatever you dreamt of as a young, a professor and at Johns Hopkins Medical Institution at Maryland. And what about the early days? What brought you to the U.S.? You said that you were in the Cancer Institute, and what made you come here? So people like you, intelligent people and talented people like you, India probably needs you there, but what made you come here?
So one of the main reasons, as I went through my PhD, I realized that I wanted to do a whole lot of more things. When you read the journals, there were new fields opening up, and there were fantastic new things going on. But we in India did not have the instrumentation or the chemicals to be able to do them. So, of course, our eyes looked towards the West, where such research was flourishing. And as I told you, I did my PhD in Cancer Institute, and right in front of our eyes, basically, we could see how the disease was overtaking small children with leukemia dying, or many women with cervical cancer, lung cancer, mouth oral cancer, very common. So when you start living like that side by side with them basically throughout the day, you realize that there is a great need for research in that area. And for me, the fastest way of doing it was to come to the United States and specialize and do it over here. So I got a fellowship to come to the National Cancer Institute. I must mention, by that time I had two children. So I
I
had
know.
one at the beginning of my PhD and one at the end of
Wow.
it. So my daughter was about 5 years old, and my son was just 2 years old when I came here. And I left the two kids with my mother and came here, and just to settle in and to make everything. And then my husband and children were supposed to join me. So when he came, my husband went to Wharton School to do his courses, and I was in Bethesda, Maryland. So that is in Philadelphia, and this is Bethesda.
Wow.
So that I had now two children with me to look after as a single parent, and trying to make my mark in research at the National Cancer Institute. Those were hard days,
Tell me
very
about it.
hard days, especially as a postdoctoral fellow. Mark my words, I was earning $10,000 a year.
Wow.
and, and with that
Wow.
$10,000 in daycare for the two children, and making sure I broke off at 6 o'clock to pick them up from the daycare, take them home, feed them, all kinds of hurdles during that time. I really struggled during that time to be able to do both. But luckily, I joined after the first couple of years a very wonderful laboratory, and I was able to do very extraordinary work that was going on because the lab was doing it. I was part of the team, and I was able to participate in some very groundbreaking work. That allowed the papers that we had during that time were all cutting edge papers, because I entered this lab and I said that tumors have oncogenes, and yes, you can detect them in 1 in 50 or so. But let's simplify this. Let us see if mice or rats, where you make the tumor come because of chemical, can you find these oncogenes in those tumors? So, lo and behold, every single tumor had the same oncogene. So, for the first time, we linked the fact that chemical exposures can cause cancer, and through what do they cause cancers? People knew for a long time, right from the time when the chimney sweeps used to go down the chimney and they used to get scrotal cancer. And it was made clear that it was the carcinogens in that chimney soot that was causing tumors in those little boys. That connection was built over and over again. We knew that if the air had very bad chemicals in it, they got tumors. They knew that if they ate fungus peanuts, because it has a lot of aflatoxin, you get liver cancer. They knew all about the cancer and the chemical, but they didn't know how to connect it. And as luck would have it, I was able to show that connection,
Wow.
that indeed this carcinogen is able to hit the gene in this fashion, in one place, always the same place, and therefore you can find this connection. So that then people started testing with every favorite carcinogen, which
Right.
gene is this carcinogen affecting this, and so it opened up a whole new field. It was sheer luck. It was very, of course, hard work as well. But that helped me to land a job in this very prestigious Salk Institute
Right.
after
Right.
my postdoctoral fellowship. Like Manjari mentioned, when we come from a foreign country, we don't have those shoulders to step on and rise. So everything you do or and will do has to be much of your own hard work. Yes.
That's very
So
true.
getting a position in Salk Institute was way beyond what I had imagined at all. And then while I was there, I got a call from Johns Hopkins saying, come on, you have to work in cancer. And so come here and start our breast cancer program. I was blown away. I was just an assistant professor. And I said, really? I should come and set up the breast cancer program. And this laureate said, yes, you must come. I think you can do it. And so I left San Diego after 6 years and I went to the Johns Hopkins, and I have been there ever since. It is a wonderful, wonderful place and has nurtured me and has allowed me to do whatever I like and be where I am today.
Awesome. How wonderful to hear that. Thank you so much, Sarasa, for sharing that. It is really amazing. As a young adult, as a young woman, always, every single one of us, especially being in a foreign country with no support, as you said, like with no shoulders, we all have to struggle to come up in life. But you know what? Every single one of us, push, pull, somehow work extra hard to make it happen, and that's the reason it's incredible for women in science. We were all sitting and discussing about how you made it. This is definitely a great story for our current and the future generation to hear and to learn to know about how they all did it, because they have lots and lots given to us. The technology, you just at a click of Google, or now they say Chat GPT, everything is available for them. When I came into this country, there was not even computer, no internet. Computers probably just started coming in. No internet, And then remember, like the AOL, it'll go. No, you have to plug it into the phone line to get the internet. We earned very hard to where we are all here today, and especially when I hear the amazing, incredible stories like this, I get goosebumps. It's amazing.
I have to interrupt you, Rose, here to tell you what an incredible woman you are. You have been praising all of us, but I was there when you gave your first concert in La Jolla, in San Diego. And I was there, and Varshini was a year-old child, still in diapers, and having met her brand new father, who she had never known before,
Right.
right?
We got married, and Murli came after 7 days, and I
That
got pregnant. I had to stay there.
that's right. That's
Yes.
right. And to struggle from that place where we were her first students, we were a group of
Yes.
7 elderly women who joined her to learn music, and from that place of having classes of 7 and 10 and so on, to build from nothing, from scratch, to where she is today, it's just an incredible journey. When I went and
Thank you.
visited
Thank
you
you.
the last year in Los Angeles, I was just blown away. I was
Thank
blown
you.
away by what you have done with your life and what Murali and you have put together in Los Angeles.
Thank you, thank you. You really made my day. And I try to do, I mean, I wanted to bring you guys and talk about your achievements. And, of course, Sarasa is one of the very few who knew us as a early 20s, young, we got married like early 20s. And then as a young two babies, having another baby in their hands, trying to
That's,
grow,
that's right.
in the world, thrown away, and only knew classical Carnatic music, nothing else. And classical Carnatic music was not appreciated in the place where we were, other than the Indian community. And it was a hard life. It was a hard life, and we all made it. And that is why, it always inspires, especially when women come to the level of achievements like all of you. It just gives me goosebumps. It's lots and lots of hard work. Thank you so much, Sarasa, for bringing that, and definitely and I had one of the beautiful things to show you of our olden days. Have any one of you recognized who are all in there? That's the sitar maestro, Pandit Ravi Shankar ji and his wife. And behind Ravi Shankar ji is Anushka Shankar, the great sitar player now. And next to her is our Sarasa. And below Ravi Shankar ji is me, and Varshini, probably she was 3 or 4 year old at that time. Murli ji, and that is Sukanya, and Raji, our other best friend, where she's the one who hosted the event. That's an amazing picture. And I was just going through, and I found that, like, I have to show everyone this. That's how life was. And I have I know, Sarasa, that this is probably over 12 a.m. for you. And she is still sitting strong, and she is in Maryland. It's 2 hours or 3 hours? 3 hours difference. Oh, wow. Sarasa, are you okay for one more question? Okay. I wanted to ask you, what do you do? I know you do little dancing for your fun time. What do you do for fun?
So recently, 2 or 3 years ago, during the pandemic, a group of women who I meet regularly for meditation said, "Would you be able to teach us music as well, bhajans?" And mind you, these are all women in their 50s to their 70s who have never sung before. So I said, if you have the heart to learn, then I am willing to teach you. So, so
Awesome.
I have been teaching them just on a volunteer basis, basically about 10 women, bhajans of different kinds. They usually bring me bhajans from the Guru Granth Sahib because they are of the Sikh faith. And we learn, and I still have notebooks from the time I learned from Rose, so I use the same swara notes to teach them how to control their voice and how to make it. And in this foray is a young couple, and their 3-year-old child started learning just by listening. And she is delightful. She just sings so beautifully. So one loves to inspire, and I am very fond of bhajans, and I have always felt very meditative and very, very calmed by them. And so this is a wonderful place to sit and just think single-mindedly on the divine. So
Wow.
that is one thing I do. And then I learn ballroom dancing. And I
Ballroom
find,
dancing. Wow. I
I
have seen some
find,
of those on the social
yeah,
media.
I find that to be a combination of really intense exercise, as well as there's music, and there is a wonderful feeling inside after you've done a bout of dancing. So I took that on because I'd learned Bharatanatyam dancing for many
Right.
years, but they are so hard on your knees and so hard on all your whole body that it simply isn't worth it to do it after the age of 55. You know, when I came to San Diego, I learned another 4 5 years of Bharatanatyam,
Right. Right.
right?
Right.
But I decided that that's not the way to go. So this has been a source of great joy and a good exercise for me.
Beautiful, beautiful. I'm so proud of you.
Thank
I'm
you.
very proud of you. And my next question is to Dr. Manjari. You are a certified mindfulness meditation instructor and have developed an 8-week online course called Mindfulness for Success and Well-Being. And please tell us about your mindfulness training and your new course for adults 18 and over. If I have time, I might join too.
Oh, absolutely. You're welcome. Yeah, just listening to what Sarsa was mentioning. I used to learn Bharatanatyam too,
Wow.
and okay, I'm thinking now maybe ballroom dancing.
Wonderful.
Yeah, and then yeah. So in terms of mindfulness, I actually started practicing in 2015 mindfulness meditation, and just after about 3 months or so of regular daily practice, I started to see subjective changes in myself. Like I was able to pay selective attention toward the task that I was doing at the moment, which made me more efficient at what I was doing. I also found that I was being more productive. I was able to, regulate my emotions better, especially when I was faced with difficult situations. I was able to persevere with patience and get the job done. And so then being a neuroscientist, I started thinking, okay, if I'm experiencing this subjectively with just 3 months of this practice, have other scientists looked at this and have they done research on this? And so, I did an extensive literature research, and lo and behold, yes, mindfulness has a lot of health benefits. Mindfulness is a type of meditation. And so mindfulness comes from Hindu and Buddhist traditions where the goal is to stay focused on the present moment experience. Our body is always in the present moment, but our mind often isn't. It's either, in the past or planning for the future. So, bringing your mind into the present moment and just focusing and just observing everything that's happening in your present moment with an attitude of acceptance and without judgment. That is what mindfulness is about. And meditation is the formal practice, and it helps us. Meditation time is time spent in silence, honing our mindfulness skills. And so, I thought, okay, let me look at what research shows about this. And so this field of research is quite young. And so they've, over the last 10, 12 years, 15 years or so, there's been a lot of work going on. And they've found that mindfulness really decreases stress and anxiety. And it also helps with equanimity, which is basically your ability to regulate emotions in the face of difficult situations. And when you're able to do that, what you're able to do is you're able to reallocate the resources in your brain to doing other things. So it really makes you efficient at whatever you need to do. So there's that success part. So the well-being is from the reduction of stress and anxiety, and then the success is from being able to reallocate those resources to things that you need to get done. And training yourself to be in the present moment helps you achieve that. So then I said, okay, I really want to share this experience. In addition to doing this research, I want to be able to share this experience with everyone. And so I decided to get trained to be a mindfulness professor or a teacher. And I did so, and I researched a whole bunch of programs, and I decided to get trained with the Koru Mindfulness Center, which was developed by psychiatrists at Duke University in North Carolina. And so that's what I did. I got certified last year.
I
And
know
then
she has this little flyer here too.
oh yeah,
And
thank you.
yes, I just found this. I
Yeah.
thought I'll just share it with
So
everyone.
this is my new 8-week course that I'm starting. The next offering is going to be beginning of May. So those are the perks. That'll be 8 weeks. We'll have 75-minute live classes each week, one class a week for a total of 10 hours. You'll learn more than 12 meditations and skills that you can add to your toolkit. We'll have a mini silent meditation retreat, which will be an interesting experience. I also will discuss some essays and podcasts on the benefits of mindfulness, so we'll talk about that in our small groups. Just so I also give you an app, which is actually quite robust, and it helps with maintaining accountability. So I'll teach you how to develop and maintain a regular mindfulness practice. And then that app, which will be included in the registration fee, will really help you stay accountable. So you'll journal your daily practice. And then, there'll be a certificate of completion when you finish. And because it's online, anyone from anywhere in the world can participate.
Yes, awesome. That's wonderful. That's really nice. And I mean, definitely, a lot of people probably will be watching, or, later on they will come back and watch. They probably will look at it and definitely.
Thank you for letting me talk about my new
course.
course.
Of course. And I have one last question for Dr. Manjusha. What are your hopes for the future of acupuncture and Ayurveda in the U.S.? Since, and you mentioned that, of course, I wanted to find out, what have been your experiences and hardships practicing these, systems of medicines in the U.S. when mainstream medicine is still Western, right? And so just wanted to find out, what is the future of acupuncture and Ayurveda in the U.S.? I think you are on mute, Manjusha.
Yeah. So I came here 20 years ago, and then when I came, the Ayurveda was not very popularized, and there was very little awareness, and then we had to start from scratch. Very few institutions were there, and medicines and formulas, what herbal formulas were very limited, and even Ayurveda still, it is not covered by insurance, and that's why it is not a licensed practice, and people have to pay out of pocket, so they always hesitate to do so. So it is still, practicing Ayurveda here is a challenge. And actually, 1/3 of American population accepts and takes a holistic, one of the system from this integrative and complementary medicine. They use as their own medicine, but still Ayurveda is not that well recognized, and definitely it is hard to practice here. And even Chinese medicine is covered by acupuncture, and everything is covered by insurance, but still it is very limited. Scope is there, and only for limited condition it covers. So it is very hard. But that these system as really have so much potential, and every system, of course, has their own strengths. Like allopathic medicine or conventional medicine is very good at acute management and of disease emergency management, as well as same way these holistic medicines are good at chronic disease management, rehabilitation and rejuvenation, and also they teach a wonderful aspect of prevention, and that's why we can practice that, and then we can prevent multiple diseases. And Dr. Saras, I really want to talk to her more about this, because like early detection and all of cancer, definitely preventive aspect is very important.
And I just wanted to chime in, Dr. Manjusha. I know Dr. Manjusha from Chimya Mission.
Okay.
And yet I also very strongly believe in preventative medicine, and that's the whole thing with mindfulness and reducing risk of Alzheimer's. it definitely, and another interesting fact is that Manjusha is from Goa, which
Yes.
is where I was raised, which is where I grew up, and I grew up not far from where you were from.
Yeah.
Small world.
Thank
Wow.
you. Yes. And then, so my she was asking, Dr. Rose was asking about my hopes. So, in recent years, this integrative medicine has emerged in an effort of combine these systems when it is appropriate, and I definitely support that. And integrative medicine still has a lot of room to grow for growth, and I hope that doctors and different organizations come together to recognize the power of integrative medicine, because we can overcome the weaknesses of each other and then combine with our strengths together, and then we serve our community is the best way possible, and by leaving our egos and self-interest to the side. And I know both of you mentioned this meditation and all, mindfulness, that helps for it a lot, prayers, everything. And with that, we should all together should work and as an integrative medicine and work for this community and serve the best. That's way we say that loka samasta sukhino bhavantu, and that is very important.
Very nice. Very beautiful. Very beautifully said. And is any one of you, I know for Sarsa it's past bedtime. And yeah, is there anything else you wanted to tell the world? And we almost are at the end of our, conversation, discussion. So if anyone would like to share anything, please feel free to tell before we end this session, please.
I would just, reiterate, since it's Women's History Month, I would say, let's make her story. Instead of history, let's make her story, and
Oh,
let's,
herstory. I
yeah,
like that.
history, yeah, and let's, follow our passions, support each other. Let's, women support women, women support men, men support women, and like I say, don't let people bring you down, and you don't bring others down. When you get the chance to pull someone up, stand up for someone, do that.
Yes.
Yeah, let's support each other
Yes.
through this.
Awesome. Thank you so
Thank you
much.
very
Thank
much.
you.
It's been a
Thank you all
pleasure
so
Thank you so
being
much.
at
much.
this panel.
Thank you. And definitely, I'm very happy to bring in, all three of you, four of you, and your talents. You are very talented uh, women, incredible women in what you do. And it is really amazing that you all agreed to come for almost like 2 hours to be with us and to share your experiences with us. And my special thanks to all of you. And I really wanted you to still do more and more and more. I know as women, we have our own limitations, but our own limitations never stop us doing anything what we do, and keep doing what you do. And as we came to the final conclusion, I would like to express my sincere thanks to not only four of you, to all of them, all the women in the world, who are incredible. And sometimes, they are not shown, to the world with any kind of a media presence. But they all are great. The best wishes to all the women out there who have made immense contributions, not only to their families but to the world throughout the history. Women History Month is an important reminder of the many achievements of women and their remarkable contributions to the society. We extend our appreciation to all the brilliant women who have broken barriers, shattered stereotypes, and pioneered in their respective fields. Thank you, gorgeous ladies, for the positive impact you have had on our society and for being a source of inspiration to many generations. We also express our gratitude to all the organizations, viewers, and individuals who have worked hard to promote gender equality and ensure that women's voices are heard. Your tireless efforts have helped advance the cause of women's rights and have made a meaningful differences. So once again, thank you all, the exceptional women who have made history and continue to do so. Your achievements and contributions have made our world a better place for all of us to live, and for that, we are all forever grateful. Thank you, and happy Women's History Month to one and all, and to all four of us.
Pleasure to meet all of you.
Thank you so much, all co-panelists. I'm very happy. We will talk
Beautiful.
Manjari again.
We will.
Thank
Yes.
you.
Likewise.
Love you all. Thank you. And bye, everybody. All the viewers, thank you for joining all of us. And I hope you enjoyed. And definitely, this is a wonderful group of women who shared their experiences. And thank you again. Share your comments, share your views, and any questions you also have, share it. And of course, they will all see the comments later on after the session is done. They will regardless of whose question it is, they will be answering you all. Thank you again, and bye now. I will meet you all again soon with yet another beautiful episode. Bye.